Hello, we're going to talk very quickly about jaw, okay? Because people don't really think what's going on in their face, basically. So here is your eye socket, and here you can see there's a dent all across here. There is the temporalis muscle, amongst other things, and it sits along there and across to the top of the ear. And if you think of your ear here, you'll realise that the front of your ear here, where this little triangular bit is here, is basically about here. And then your ear comes up like that, okay? So your temporalis runs across here, and your joint here, which I'm now going to open and close there like that, it opens and closes in front of here. And then there are muscles behind this jawbone, which you'll be able to feel here at the back in this section, that are clamping down. And there are muscles here which attach to the cheekbone, which you'll see here. It's like, I can actually get my finger under it. So there are muscles called masseter muscles, and there's a whole row of them, and they run down that section and clamp onto here so that they're clamping and clenching. And you basically need both the pressures on this side and that side, the pressures behind here on this side and that side, the tensions at this point here where the temple and the mandible, which is this lower jawbone, meet, the joint there, and across here. They need to be the same because of the way this bone works, okay? So here's your mandible, and it opens and closes. It doesn't actually open quite like that. It actually opens in a position that it opens, and then as it gets further, can you see I'm moving the jaw through and forward? So it's moving up and back, and then it drops down and forward. And that's the point at which you can sometimes get a lock on one side of the jaw. And so suddenly you can only get it open very, very slightly. Whereas what should happen is you should be able to get 3 of your fingers in, like that, at the centre point. Okay, if you've got less than that, there is an issue going on with your TMJs. But something else to be clear about is that you can have a clicky side of your jaw, and that's normally not the problem side, and that can be confusing for people. So if you've got a tension on this side and it's really solid, when the jaw opens, instead of them both being able to open, when it gets to that translation thing where it jumps, at that point it jumps out of this side. You see it there jumping out because it's so tight here, it can't move on this side. Then it jumps back in and jumps back out and jumps back in, but the issue is here. So if you open and close and you're looking for a centre line here, if you see your jaw goes open a bit and then goes off to one side, it's going towards the side of the dysfunction where it's too tight. And some of the exercises that we quite often give people will help to release this side, but don't work just on one side. Work on this side first. It tells the brain, which sends messages down to this side and this side at once. And then when you work this side, it's already had half the message, okay? So inside your mouth, when you open and pull the lip down and up, you'll find you have a little membrane here that attaches to this bit on the bone, and you'll find you have a little membrane and it's attached to this little bit on the bone. And so you know whether your jaw's to one side or the other. If you're too frenular there, I use this stick, if they're not lined up. So if one's up here and one's slightly over here by 1 millimetre or 2 or over here, you know that the jaw is out, no matter what they've done to the teeth. Okay? Now, what we would do with people is sometimes say to them, bring your jaw out like this and forward, up and forward. So you can see here I'm amending it. And what that does, if I do it here with a stick, a lollipop stick or whatever, it's run across on both sides. But can you see it's put a space in the between the teeth, but more importantly, it's put a space back here. And if I was to increase 2 or 3 sticks, I would effectively have a dental splint, which would pull the jaw out bigger and you'll see it's creating more of a gap here, which allows this pink flesh disc to heal and to rejuvenate, and that's what needs to happen. Sometimes it's been pushed out. I can't go into too much detail on here, but it can get displaced and be completely out of position. But if you can possibly avoid surgery, if you can give the joint a rest, you never know what might be possible on healing, especially if you keep talking to it every day, talking to it in terms of reminding your brain there's an issue here, there's an issue here. Learn, never say never. Okay, that's not false promises, but just never say never. Okay.